Some White House officials are saying it could be February before health care reform makes it to the president's desk. Can a compromise be reached between the House and Senate version, or is this where health care reform dies? Here to weigh in, our congressional panel, Democratic Congressman John Yarmuth of Kentucky, Republican Congressman Tom Price of Georgia. Gentlemen, before we get into that discussion, I know you've been following the news very closely, as all Americans have, of this incident that occurred over Detroit yesterday. Congressman Price, I'll start with you. Any thoughts about what you've heard?
Well, I just think it's important to appreciate that this wasn't an attempted act of terrorism. This was an act of terrorism. And I think that what the American people need to know is, what does it mean to be on a watch list? Does that mean that there's greater scrutiny when you get on a plane anywhere in this world coming to the United States or traveling within the United States? There are real questions that need to be answered, and the American people are demanding those explanations.
Congressman Yarmuth?
Oh, I think Tom's absolutely right. And one of the things that's bizarre is if this guy was on a watch list and was not on a no-fly list, when people like Ted Kennedy were on a no-fly list, I think we've got to get our system straight there, because clearly this guy should have been on a no-fly list as well. But Tom's absolutely right. You know, we've got a lot of threats out there that we have to face, and I mean there's an order of magnitude here, and you can't protect against everyone. But again, when this guy was identified apparently for over 2 years as being a potential threat, he never should have been on that plane.
All right, now let's talk about the issue of health care reform. The Senate has passed a measure. Many people believe, Congressman Yarmuth, that the Senate measure is the one that will likely prevail. Will House members try to substantially change this piece of legislation?
Well, I think there's going to be a lot of pressure from members of the House, particularly from the Progressive Caucus, people who want the public option included. In the final analysis, we have a little bit more margin of error in the House than in the Senate. I mean, clearly they have a one-vote margin of error there. But I think there's going to be a lot of pressure on both the Senate Democrats and the House Democrats to support whatever compromise is reached, whatever's negotiated between the two bodies, because this really does represent a huge step forward in terms of the priorities of the Democratic Party in ensuring virtually every American and strengthening Medicare,
right,
and providing some accountability for insurance companies. So I think there's going to be a lot of pressure to go along with whatever compromise is reached.
Congressman Price, Republicans basically will be sort of on the sidelines watching the Democrats squabble among themselves on this one, won't they?
Yeah. Well, Brian, what you heard from Congressman Yarmuth is exactly right, and that is that this is a priority of the Democrat Party, but it's not a priority of the American people. I think it's important as we get to this stage to step back and think about what this was supposed to be. It was supposed to be a very transparent process. C-SPAN, you were supposed to be able to see what was going on. It was supposed to be a bipartisan process, and it was supposed to be a process that was going to improve the health care of the nation. It's been the most closed, secretive process, anything but bipartisan, as the votes in both the Senate and the House demonstrate. And as a physician, I can tell you that it's going to get in between patients and families and doctors in their decision-making. So that may be a priority of the Democrat Party, but it's not a priority of the American people, and they're demanding something different.